Hi, on behalf of Group 4, I'd like to introduce Mrs. Jane Condy. Mrs. Condy is currently the Assistant Director of Experiential Education here at the University of Charleston School of Pharmacy. She graduated with her Bachelor's of Science degree in Pharmacy from West Virginia University. She has worked in many fields of pharmacy during her career, including hospital, community, infusion, and long-term care. Now that I've introduced Mrs. Condy, you will get the chance to learn about pharmacy from her perspective.
So why did you choose pharmacy?
Well, I started years ago when I was in middle school. That was the time when I started thinking about what I would like to be. And I really liked the science classes, so that sort of led me to think of something in the healthcare profession. So I sort of did my research and looked at the different areas of healthcare, and pharmacy just kind of stood out. So I went to a local pharmacy, sort of shadowed there, and I decided that's what I wanted to do, and so that was my goal, and I just started working towards it. And I would still do it again 36 years later.
So what's one important thing that you feel that needs to be said to P1 students?
P1 students, I think just persevere, get through it. I know it's hard, and sometimes everything doesn't pertain to actual pharmacy practice, but you're learning the basics, so as you go through the program, it'll all make sense in the long run, and you'll have a better understanding of how drugs work.
School is overwhelming as P1s because it's all a new experience. Do you think that it would be wise to keep our hobbies and incorporate those into our school, so we don't get so...
Well, you have to have a good life balance. I think it's important to realize, even though you feel like you need to study a little bit extra for that exam, you still have to make room for a social life and for things that you enjoy doing, because that's going to make you a well-rounded person, make you happier, and actually calm you down, and probably make you retain the information that you're trying to learn. You just can't study all the time.
So don't go.
Don't go.
Gotcha.
You have to make time for other activities.
At what point in our pharmacy education do you think it's important to really focus on what area of practice we're looking for?
Well, to be honest, I think you need to keep an open mind throughout all the years, because I've had so many students tell me they're going to go into community pharmacy practice, that's what they want to do, and then they'll have a rotation their second year, between their second and third years in a hospital or an institution, and then all of a sudden they come back from that and they say, oh, I'm going to do institutional pharmacy. And then you really don't make up your mind until you're on your P4 rotations, because that way you'll be open to seeing all the different experiences. And during your rotations, you will be able to select maybe different areas of pharmacy that you really hadn't thought of. We have some in the prison system, with the VA hospitals. We have non-pharmaceuticals for industrial pharmacy. We have a lot of clinics, like there's a clinic that we have rotation in ambulatory care, Cherokee, North Carolina, with the Indian reservations. We have ones in Alaska. We have ones with organizations like the DEA, FDA, like in DC, that you have to apply for. I mean, there's just so many different areas of pharmacy. I don't think that you should nail down exactly what you want to do until you have that wider experience of pharmacy.
What are some of your strengths that you think helped you as a pharmacist, in through school?
Well, I think as a student, I was very goal-oriented, and I think knowing that, I wanted to be a pharmacist from when I was in middle school, so I'd always had that goal, was to become a pharmacist. So I think having the end goal kept me, motivated me to keep studying and do well on my tests and in my classes so I could get accepted to pharmacy school. And then as I got out of pharmacy school, I think probably what helped me the most is being able to communicate well with people, and personality. I like people. I like to work with people, and I think that comes through. And it's always helped me be successful, especially when I had my business. Just being open to people and communicate well is a big thing.
So what about weaknesses? Everybody's afraid of their weaknesses. What would you recommend for a student to surpass those weaknesses?
Well, I think best way to get over weakness is actually to practice in that area. And I know it's probably would be hard for anyone to know, but I'm actually can be kind of shy. and even, it's taken me a long time. And, being the experiential director, I have to go out and make visits to preceptors that I don't know. And it's really uncomfortable for me to go in and try to speak to someone I don't know. And but over the years, I've just made myself do it, put myself in situations where you have to come out of your shell and do it. And actually taking this position here, I'm not a public speaker, and so I've really come out of my comfort zone, to get in front of a group of people and give a lecture or talk to people. So it's just, I think the best way to get over a weakness is to hit it straight on and try to do it and put yourself in situations where you can try to overcome it.
What do preceptors expect from us, and what should we gain from them from our experience sites?
Well, preceptors expect you to have some knowledge about basic pharmacy and to be able to come in there and at least answer the phone, help them count their prescriptions, put drugs back on the shelves. They don't expect you to know everything, and they know at what level that you are when you come in there, and at the higher level they expect more from you. But and then you should expect the preceptor not just to have you be a set of hands and count medications all the time, but they should be explained to you why they do this or why they do that, their thought process in doing certain activities. So what I try to do is I'll have like a workbook with activities that you'll be doing that helps guide the preceptor into what areas they need to show you. Like it might be controlled substances, or it might be OTCs or ordering medications, how to order C2s, things like that. So to kind of let them know that they need to touch on those areas.
Did you actually work inside a pharmacy before going to pharmacy
Yeah,
school?
I worked at a local pharmacy here. A lot of it was making sandwiches at the snack bar.
Hey, you gotta start somewhere.
But you're still in the same building.
You said you've been doing this for quite a while. What's your favorite thing about being a pharmacist?
I think that you really can be a member of you're a respected member of the community, and you have a lot to offer. People look up to you, so you have a responsibility to help educate people or point them in the right direction, help them find things. I think that's one of the things I enjoy, like maybe helping them find a plan to help pay for their prescriptions, solve
More
problems like
community
this.
So, like,
involvement.
interaction.
The
Interaction.
field of pharmacy is changing.
I think it's changed quite a bit. And I mean, when I went to pharmacy school, the main focus was on the sciences and not so much on the clinical pharmacy or even the thought processes into making decisions that you guys have. So those are things I had to learn out while I was doing pharmacy practice. So I think it's really a good trend towards using all the medication knowledge that pharmacists have, because I think we had the knowledge, but we were never actually able to utilize it in a clinical way that you guys do, and I think that's where it's going to fit into as healthcare progresses into the team approach, and I think that's going to be a great move for pharmacists.
So change is a good thing, right?
I think it's a good thing. That's a lot more accountability, you have a lot more responsibility, but you're more of a part of the team than what we were in the beginning.
Can you explain a little bit to us, you talked about many roles that you've been into, about home infusion. Can you just give us a little bit of information on what exactly is involved in home infusion?
Sure. Well, home infusion is sort of a niche in pharmacy, and it is where you prepare parenteral products, IVs, injectables that are administered to patients in the home. They're not in a clinic, they're not in the hospital, so it takes a little bit of expertise for the pharmacist to determine which drugs have, say, a stability that will allow them to go to a patient's home and be in their refrigerator. And it's not feasible to deliver medications every day, so you have to make sure that they're stable for like at least a week, and you have to make deliveries. You also have to assess the patient to determine their abilities to administer medication at home or their family. So you make decisions on whether it needs to go on a pump that can run for 3 days, or if they can actually administer it themselves once or twice a day, and they're able to flush their lines. There's a lot of communications involved in that because you're sort of in between like the doctor's office and the home health nursing that's going out and helping with assisting the patients, and then also with like the social workers at the hospital, like in communication with insurance companies. So it's like basically coordination and communication is a big piece of this.
Wow. That seems like a lot of work. Do you have any advice to young pharmacists that are looking to own their own pharmacy on how to start their pharmacy?
Well, I would say number one, you have to find the right location. So you would need to find the area that you're interested in and look and see how many pharmacies are in that area and if there's actually room for your pharmacy, because you don't want to start up if there's too much competition that you won't be successful. And then you need to contact your state board of pharmacy right away, and they will help you with the process of what kind of license you get and everything. And then once you get them involved, they'll help you get signed up with the DEA, and then you have to have those two. Then you have to have a supplier, a wholesaler, and then once you get all that in line, then you're good to go. Well, I'm now in my 5th year here at University of Charleston, and this is another thing, you don't really know what you're going to do when you start as a pharmacist. You don't know where you'll end up. So when we had our home infusion business, we were fortunate we had someone to buy it, so we sold our business. At that point, I really didn't know what I wanted to do. I heard about the opportunity as the Assistant Director for Experiential Education at UC. Well, having been a preceptor for years and years, I really enjoyed working with the students, and I thought, I know most of the preceptors around because I've been in the community for so long. It just seemed like a perfect fit because I got to be with the young people, and then I get to work with preceptors that I've known for years. So I've really enjoyed it. It's been a good fortune for me.
Awesome. Perfect. Awesome. Well, thank you for your time. Really enjoyed all this information that you've given us.
Well, thanks.
You should know that I've got you on my mind, your secret admirer. I've been watching.